Post-traumatic stress disorder, PTSD, is a psychological condition that affects individuals who have experienced or witnessed a traumatic event. It can have a profound impact on their mental health and overall well-being. In this script, we will explore various aspects of PTSD, including its introduction, epidemiology and prevalence, diagnostic criteria, neurobiology, trauma and PTSD development, diagnostic assessment, symptomatology and clinical presentations, psychological treatments, pharmacotherapy, comorbidities and associated disorders, special populations, and the role of neuroimaging in PTSD research. PTSD is a psychiatric disorder characterized by the development of distressing symptoms following exposure to a traumatic event. These events can involve experiences such as war, natural disasters, physical or sexual assault, accidents, or witnessing a traumatic event. PTSD affects individuals of all ages and backgrounds, and its impact can vary from person to person. The prevalence of PTSD varies across different populations. Studies have shown that military personnel, veterans, and individuals who have been exposed to combat or war-related trauma are at a higher risk of developing PTSD. Other populations at risk include survivors of accidents, natural disasters, and interpersonal violence. Prevalence rates also differ among specific demographic groups and can be influenced by various factors, such as gender, age, and socioeconomic status. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, provides specific criteria for diagnosing PTSD. These criteria include exposure to a traumatic event, the presence of intrusive symptoms, avoidance and numbing, negative alterations in mood and cognition, and alterations in arousal and reactivity. The DSM-5 criteria help clinicians in accurately identifying and diagnosing individuals with PTSD. The neurobiology of PTSD is a complex field that involves the intricate interplay between the brain, the nervous system, and various neurotransmitters. Emerging research has highlighted significant alterations in brain regions like the amygdala, hippocampus, prefrontal cortex, and hypothalamic pituitary adrenal, HPA, axis among individuals with PTSD. These changes play a crucial role in the development of symptoms such as heightened arousal, intrusive memories, and difficulties in regulating emotions. Understanding these neurobiological underpinnings is crucial for developing effective treatments and interventions for individuals suffering from PTSD. Understanding the relationship between trauma and the development of PTSD is crucial. While not everyone exposed to trauma develops PTSD, various factors modulate the risk and resilience. These factors include individual vulnerability, genetic predisposition, prior exposure to trauma, access to social support, and the nature of the traumatic event itself. Exploring these factors can provide insights into why some individuals develop PTSD while others do not. In order to provide effective treatment and support, it is important to accurately diagnose individuals with post-traumatic stress disorder, PTSD. This involves using specific assessment tools such as structured interviews and questionnaires to evaluate symptoms and determine if PTSD is present. It is also essential for clinicians to distinguish PTSD from other conditions that may mimic its symptoms, such as depression, anxiety disorders, and substance use disorders. This comprehensive diagnostic assessment helps ensure appropriate treatment planning and intervention tailored to the individual's needs. Post-traumatic stress disorder, PTSD, is a complex condition that presents with a wide array of symptoms, which can occur shortly after a traumatic event or persistently over time. Individuals suffering from PTSD may experience intrusive thoughts and memories of the traumatic event, as well as vivid flashbacks and distressing nightmares. They may also exhibit avoidance behaviors, actively avoiding any stimuli that may remind them of the trauma. Hypervigilance, characterized by a heightened state of alertness and sensitivity to potential threats, is another prevalent symptom. Emotional numbness, social withdrawal, and difficulties with cognitive functioning, such as memory and concentration problems, are also commonly observed in individuals with PTSD. Understanding the various clinical presentations of PTSD is crucial for identifying and providing appropriate treatment for those affected by the condition. Psychological treatments are crucial in treating PTSD. Effective therapies like cognitive behavioral therapy, CBT, prolonged exposure therapy, PE, eye movement desensitization and reprocessing, EMDR, and cognitive processing therapy, CPT, have been shown to reduce PTSD symptoms. These therapies target negative thoughts, emotions, and behaviors related to the trauma in order to help patients heal. While psychological treatments are the primary intervention, pharmacotherapy can also be beneficial, particularly in combination with therapy. Selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, and alpha blockers are some of the medications commonly used to treat PTSD symptoms. However, medication choices should be individualized based on patient characteristics, comorbidities, and potential side effects. Post-traumatic stress disorder, PTSD, frequently presents alongside various psychiatric disorders, including depression, anxiety, substance use disorders, and sleep disturbances. Integrating treatment strategies for these comorbidities is crucial in order to achieve favorable outcomes and enhance overall patient well-being. Healthcare professionals must grasp the intricate connections between PTSD and these associated disorders to ensure comprehensive care and effective interventions. By addressing these co-occurring conditions, clinicians can successfully enhance treatment outcomes and improve the overall quality of life for individuals affected by PTSD. Post-traumatic stress disorder, PTSD, can affect different populations in different ways. For children and adolescents, it is important to consider their developmental stage and provide age-appropriate interventions. Refugees and immigrants may have additional stressors related to their migration experiences, language barriers, and cultural differences. First responders and healthcare workers often face repeated traumas in their line of work, leading to a higher risk of developing PTSD. Individuals who have experienced interpersonal violence, such as domestic abuse or sexual assault, may have unique triggers and require trauma-informed care. Understanding these specific challenges is vital for delivering effective care and support to these populations. Neuroimaging techniques, such as fMRI and PET scans, have made significant progress in our understanding of PTSD. By using these imaging methods, researchers have been able to pinpoint certain brain regions and circuits that play a crucial role in the development of PTSD. These findings are a crucial step towards the development of targeted interventions and the identification of potential biomarkers for this disorder. The use of advanced neuroimaging techniques holds promise for improving our understanding and treatment of PTSD in the future. In conclusion, understanding the intricacies of PTSD is vital for healthcare professionals providing care to affected individuals. From the introduction to the neurobiological underpinnings, clinical assessment, and treatment options, exploring various aspects of PTSD enhances our ability to identify, diagnose, and manage this debilitating condition. Ongoing research and advancements in the field will undoubtedly lead to further refinement in diagnostic criteria, treatment modalities, and improved outcomes for individuals living with PTSD.